Thank you. So AB 339 makes a number of changes to the Knox-Keene Act with respect to the provision of prescription drug benefits. I won't go through them all, but a couple of them include limitations on cost sharing for a month's supply of a drug and providing standardized definitions for health plan formulary tiers. So we're requesting limited term resources in the amount of $733,000 for fiscal year 16-17, $700,000 for fiscal year 17-18, and $558,000 for 18-19 and 19-20 to produce the filing guidance and related materials to demonstrate that plans are not placing drugs in high-cost tiers to discourage enrollment, and to conduct on-site surveys of health plans to verify that prescriptions are not placed in the highest cost tiers within the formularies. This request also includes resources to promulgate one regulation that will specify how the monthly caps on prescription drug out-of-pocket expenditures will work in practice, and what types of formularies will constitute a discriminatory benefit design.
Is there a stakeholder engagement process along with this?
Yes, there is. It will largely be encompassed within the regulation promulgation process. We will begin drafting the regulation this summer and hold stakeholder meetings in late summer or early fall of this year, and then begin formal rulemaking in early 2017.
Okay. LAO, Finance. Public comment.
Tama with Health Access, we were also the sponsors of this bill, which will help patients with serious and chronic conditions afford their drugs, and we support this BCP and look forward to the stakeholder process.
These Health Access bills cost a bunch of money. Golly, Tam. Next witness.
Linda Way with Western Center on Law and Poverty. We supported the legislation and so do support the BCP, but do raise questions regarding the cost, so would like a closer examination of that.
All right, thank you. We'll hold this item open. Moving on to issue number 8, Provider Directories, SB 137.
So Senate Bill 137 expands on provider directory requirements by establishing clear, specific, and ongoing requirements for publishing and maintaining health plans' provider directories, including content, updating, and reporting standards. For this proposal, the DMHC requests 8 permanent positions, $1.4 million for fiscal year 2016-17, $1.36 million for fiscal year 17-18, and $1.18 million for fiscal years 18-19 and ongoing to address the increased workload resulting from passage of the bill. The workload includes a number of areas. In our Office of Plan Licensing, we will need to determine the criteria and requirements for implementation and annually perform a comprehensive review of the submitted filings that are required under 137 for approximately 123 plans. We will need to expand the scope of our routine medical surveys, approximately 35 we conduct each year, review deficiencies, and monitor corrective actions with respect to this bill. Our Office of Financial Review will perform claims reviews of the 123 plans on a 3-year cycle, approximately 40 per year, and perform an annual review of the plan documentation with respect to any withholdings of claims that are done under the provisions of the bill. And we anticipate processing 15 137 related enforcement matters each year, with probably one going to trial based on historical enforcement caseload.
Could you address the questions on page 26?
Certainly. So the second question had to do with stakeholder engagement. So it's already commenced and will continue throughout 2016, including the department holding at least one public meeting. In addition, a series of stakeholder meetings will be held beginning in late April or early May to provide updates on the department's implementation of this bill and the elements of the law that go into effect on July 1 of this year. We've also been talking extensively with the plans regarding technical assistance and guidance for this bill, and that kind of leads me into the third question on the agenda. Yes, we created a checklist and compliance materials to assist plans with the submission of their filings related to the provider directory or directories. In fact, that checklist was finalized yesterday after we got input from the association and disseminated to the plans. Plans based on that checklist, they will need to submit the filing in accordance and all the exhibits that are required by April 22nd of this year. And so the department can determine if they're in compliance by July 1st.
And so since the checklist has been approved, can it be provided to the committee?
Absolutely.
Excellent.
That's it.
LAO, Finance, Public comment.
TAMA with Health Access, we were the co-sponsors of this bill, and I just want to say fee-supported special fund. This bill will help consumers who are either shopping for a plan or trying to use their plan know what doctors are actually in network, accepting new patients, have accurate information about where the doctors are, where they can be found, what languages they speak, and whatnot. We support this BCP, although we want to note that we want to be actively involved with the stakeholder process. I think with regards to this checklist, this is the first time I've heard of it, and as the co-sponsors of the bill and as consumer advocates, we request to be included in these processes and have the opportunity to engage and review these materials before they're finalized and go out to the plans. And we hope that we will be included in those conversations going forward. Thank you.
I think that's challenging. When did you say you're going to convene, or you convened one stakeholder meeting?
We'll have one public meeting, but we'll have multiple stakeholder meetings with
Okay.
specific groups as we work through the implementation of the
Okay, thank you.
Kimberly Chen with the California Pan-Ethnic Health Network, also a co-sponsor on the bill. Again, first, we've heard of the checklist as well, and so do urge continued stakeholder engagement, especially on behalf of consumers, which this bill is intending to really inform, but do support the BCP to implement SB 137.
Thank you. Next witness.
Linda Way with Western Center on Law and Poverty. We supported the legislation, so do support the BCP, but again raise some questions regarding the cost, so would like greater scrutiny around that.
Sarah Flox, California Labor Federation, in support of the BCP.
Michelle Cabrera with SEIU California, and just want to draw the committee's attention to the fact that both this bill as well as SB 964, given the prominence of managed care in Medi-Cal, will give us the opportunity, once implemented and if implemented properly, to better assess access for Medi-Cal beneficiaries and whether that access is adequate and timely. And so we urge timely implementation of these and look forward to being involved.
Thank you. Western Center, can you come back to the mic? This is the second time I think I've heard you express interest in the price tag. Are you questioning the need for the number of FTEs, or just a general desire around fiscal oversight? I just wanted to make sure I understood your point.
We would like to. I think we do question a little bit of the FTE, considering that there have been efforts related to the provider directories and timely access, if there could be some staffing, if there's any staffing overlap there.
Okay.
So would like to get a closer look at that, as well as general.
Okay, thank you. I just wanted to make sure I wasn't misinterpreting your point. Thank you for that. We will hold this item open. Moving on to issue number 9, Vision Services, AB 684.
AB 684 repealed Business and Profession Code prohibitions that caused optical companies operating under a co-location business model. So to use an example everybody knows, like lens crafters, where you have the dock in the back and you have the dispenser out front, to be in violation of California law. This bill authorizes the establishment of landlord-tenant relationships between a registered dispensing optician, an optometrist, and an optical company, as long as certain lease agreement provisions are met. The DMHC requests 2 permanent positions and $308,000 for fiscal year 16-17 and $292,000 for fiscal year 17-18 and ongoing to conduct legal research and policy analysis, perform in-depth reviews of existing plans licensed for vision services to ensure compliance, review new vision plan filings, and perform ongoing review of these vision plans.
Thank you. LAO, Finance. Any public comment on issue number 9? Seeing none, thank you very much. We'll hold this item open. Thank you. Appreciate you. Thank you very much. Moving on to item 0530, OSI. Issue number 1, we're going to hear about Cal here. It's page 30 of the agenda. This, too, is a budget change proposal request with a series of questions on page 32.
Madam Chair. My name is John Boulay. I am the Director of the Office of Systems Integration for Health and Human Services. It's good to be back in front of the
Thank you very much. Glad to have you.
With me today, to my left, is Mr. James Duckins. He is the Project Director for the CalHERS project. And to his left is Matt Schuler, who is the Chief Administrative Officer for OSI. In the audience, if we need to phone a friend, we have a couple of friends with us that are project sponsors of the CalHERS project. We have Ms. Renee Malo, who's the Deputy Director for DHCS, as well as Karen Reese, who is the Chief Technology Officer for Covered California. As I said, I'm happy to be back in front of the committee. Last year, we had an extended discussion about the CalHERS application and where we were, and the committee members had a few items that said we're going to be monitoring these things, and we're expecting progress on them. And I'm happy to report that we have made significant progress over this last year. One of the items that the committee emphasized was, we don't want you just moving fast. We want you moving with quality and improving the quality of the application as you do releases to our stakeholders. Happy to report that our quality has gone up, and that's due in part to our improved governance process, as well as our collaboration with our SAWS partners and our county partners and healthcare providers as we go through this. And we'll get into that in a little bit. I mentioned our improved governance process. Last year before the committee, we were sitting here talking about we need to implement a new governance process. We have implemented that new governance process, and it has paid substantial dividends as we've gone through this year to be able to collaborate and make some of the hard decisions that we have to make. We can't do everything at one time, but we need to be able to walk in unison as we go through this process.
And your governance process helps you prioritize which issues will come first, second, third.
As we go through this, one of the things is for the project, it's really coordinating and collaborating across the 6 systems we have to collaborate with. So we have the CalHERS application. We have the C4 application that serves 39 California counties, which is the SAW system. We have the CalWIN system that serves 18 California counties. We have the LEADER system that serves LA. And now we have the LEADER replacement system that is going through rollout right now that we also have to collaborate with, as well as the MEDS, the Medi-Cal Eligibility Data System, that we have to coordinate with. So as we look at a release of CalHERS, it's really a 6-tiered chessboard that we have to coordinate these things with. We know that each one of our SAWS partners who support many different programs, the only changes that they make just aren't CalHERS and Affordable Care Act changes. And especially as LA is rolling out its new system, we have to coordinate and collaborate these things. So the CalHERS governance process really looks at the coordination, collaboration, and really capacity of each one of those partners. In regards to priorities, we rely on our project sponsors, Department of Healthcare Services, as well as Covered California, to look at what their business priorities are and what changes they make. They interface with their business partners and stakeholders to be able to bring their priorities, what's needed in business, and then those come into the project to be able to collaborate and slot them into investigation, initiatives. We have to scope those items in summits and then actually slot them for releases. So it is a split sort of roles and responsibilities. It's coordination, and then the business partners are the responsibilities of those departments. The other thing that the committee really looked at was a couple of key items on functionality that needed to go forward. One of those was Senate Bill 1341, and moving the MAGI Medi-Cal notices from being generated at CalHERS to moving those to our SAWS systems so that our county eligibility workers could review that notice and, if necessary, make changes to that so that they can manage that relationship. Right. I'm happy to report that.
So those notices could be personalized so people would know.
And they can look at those and look at all of the eligibility associated with it, and if they needed to make some changes associated with that. That just got implemented this month, I'm happy to report, and it was a very big effort to be able to do that.
That's a huge deal for the local level. That's great to hear.
The other item was making sure that our system is providing support to former foster youth, especially as we come into open enrollment. Prior to open enrollment, we implemented functionality to be able to make sure that former foster youth could access the system and apply for the benefits that they're entitled. So that happened before open enrollment, and we've put in some additional functionality to optimize that. So I'm really happy about these accomplishments, but these are accomplishments that entail the counties, our SAWS systems, our eligibility workers, our sponsors, and OSI and our project team working together. As we go through this today, if it was okay with you, Madam Chair, I was going to ask Matt Schuler to give an overview of the budget change proposal that's before the subcommittee, and then Mr. Duckins and myself, we're going to go through each one of the questions that are posed by the committee.
And as you address the specific questions posed by the committee on page 32, I'd also like to hear your response to kind of the issues raised on the bottom of page 31 with regard to the new 24-month roadmap and its lack of details, the end of 4 and 5 services. That's of utmost concern to me. So if you could weave that into your response to the questions, please. Thank you.
So very briefly, Madam Chair, members, the proposal in front of you today is based on the interest of the two sponsoring departments, Covered California and the Department of Healthcare Services, to have OSI take an expanded role in the project management of the CalHERS project, which would allow OSI to focus on project management and in turn allow the sponsor departments to focus on the business needs and how best to accommodate those and incorporate those within the technology.
Makes sense.
So in order to effectuate that, this proposal requests the transfer of 58 existing positions from Covered California to the Office of Systems Integration, and in addition establish 2 positions for administrative support. And it also requests an increase in the OSI expenditure authority totaling $8 million in order for OSI to receive reimbursement for those costs from both Covered California and the Department of Healthcare Services. So the proposal itself is pretty straightforward. If there are no questions with regards to that, we can address the other additional questions.
Please.
All right. The first question that was posed was explain how the transfer of these positions from Covered California to OSI will improve project management oversight of CalHERS, and please explain who will take responsibility for project outcomes. I'll take the second question first. Myself and Mr. Duckins take responsibility. We're responsible for the outcomes of the project. In regards to the first question, functionally, the CalHERS project has been reporting to OSI since last spring, as both project sponsors approached OSI and asked us to take on this expanded role. As Karen Reese, who's the Chief Technology Officer now for Covered California, moved into that role, both the project sponsors approached us and asked us to perform the recruitment for the new project director. I am very happy that we're able to entice James to come over and be our new project director. As he came on board, we worked through the transition with all of the stakeholders bringing James on board, but the first thing was to implement that new governance model to be able to put that in place. So that was the first thing that he had on his plate as he went forward, is to put that in place. That is a 3-tiered governance process, again, looking at how we coordinate across the various systems that we have based on the project sponsors' priorities. So we have a program coordination committee. Those are managers from our systems that get together to says, what are the constraints across the various systems that we have to be able to accommodate? For example, the leader replacement system rolling out. What are those dates? How do we accommodate those? What are some of the major SAWS release dates? What are some of the restraints for meds? What's the capacity for everybody, and where are we at? So that's one of the things that that does at the program coordination meeting. The drivers on this are our project steering committee. And our project steering committee takes any escalated items, looks at all the scope, schedule, and budget associated with the decisions or escalated items from our project coordination committee and makes decisions. And James chairs that and facilitates that, but our two sponsors are the voting members of that. And those are opened up, and we have extensive involvement from CWDA as well as our SAWS participants. And then we have an executive steering committee that has Peter Lee, the executive director of Covered California, Jennifer Kent, the director of DHCS on that, as well as myself, that's looking at contract, budget, scope, and escalated items. That has come to fruition and been put in place and has been exercised quite extensively as we've gone through. So as we've talked about, it was very important as James came on board and OSI started taking on day-to-day management, functional management of this, to define roles and responsibility and make sure that we're swimming in our lanes and making sure that we're documenting those things. So bringing about project rigor and discipline. So one of the things that James and his staff have been working with our system integrator on is bringing in that rigor for some of those tough decisions. When do we have to have the requirements? When do we go to design development? And is there adequate amount of time to be able to test these to improve our software delivery? Those metrics have been developed, and we're having tough conversations if policy hasn't been made or requirements haven't been there, that there's going to be some give and take on whether those things can be in a release or have to slide or what has to give and take. And that governance process is being worked very hard to be able to do that. So with OSI, we've been involved since day-to-day operation since last fall with the recruitment of James all the way through today. Our involvement's going to be to continue to mature our processes, continue to improve the quality of our system, and improve the delivery pursuant to the sponsor's business needs and desires as we go forward. This is an administrative shift, but also part of this is having the CalHERS project involved with OSI, our meetings, integrating them into our meetings so that we could learn from the project and the project learns from us, and we have resources and people that we pull from within our organization that are experiencing the same thing, like procedures, lessons learned that we apply across the board. Okay. The next question, advocates have used DHCS, stakeholders meetings, and Covered California board meetings to obtain more details on project schedules and to provide input on the order of programming priorities. Please explain how this will continue if CalHERS oversight moves to OSI. It will not be impacted. Both sponsors continue to have responsibility for their stakeholder and advocate relationships. Those meetings continue, and there will be no change in how that forum is addressed. The departments will do that.
And does it also mean that your business partners, the departments, are also the ones who make the prioritization decisions?
Yes, ma'am.
Because we had quite a bit of conversation last year, as I recall, about the criteria that's used. And it's just come to our attention that we know that CalHERS still has some issues with a couple of functions, income counting and immigration status determination. Later on in the agenda, we're going to hear about issue number 6, the newly qualified immigrants, and it appears that that has kind of moved up in the priority list. So I want to be clear, USI doesn't make that priority decision. That's your business partners. You execute.
Correct.
Okay. Thank you.
And when
I know who to ask the question to.
And when our partner comes in with a new priority, because priorities change and there's functionality that's needed, the project has to go back and look at what are the options to be able to slot those things in time, or can they be, to make sure that we have quality software releases. And I think this goes to the next question on why did the format of the 24-month roadmap change, and has OSI received any feedback on that? I think the first response is the earlier version of the 24-month roadmap was a listing of everybody's desires on where they wanted all of these items. And as we looked out past 24 months, a lot of these things had moved. As we look at the roadmap today and the way that it's been reformatted, it has change request numbers. It has specificity all the way to the end of calendar year 16. Those are commitments. We are working through those, and that's how we're going forward. We have started the strategic planning with the sponsors to be able to plan what are the initiatives for 2017. The difference between a change request and an initiative is what is a priority that we're going to be looking at and investigating, but we can't make a commitment until we sit down, aren't able to define that scope.
Right. So
and what is that
the
scope
vision
of work
versus the brass tacks.
Right. But it has to be a dynamic rolling document where the specificity comes. So as we're looking at our release in the first quarter of 2017, we're starting those meetings in short order to be able to list those CRs and those items. So we now have from Department of Healthcare Services and Covered California those list of initiatives that we're putting on that and being able to publish that. I know that James and I are going to be meeting with SEIU and their local members on April 15th and walking through that priority roadmap that to be able to show them what the departments have planned for 17 and the initiatives to be able to investigate that. And I'm sure probably Deputy Director Malo will be coming with us to that meeting as well.
And I think that'll be helpful because what's so striking is it's different than what we've grown accustomed to in terms of the roadmap. And so I appreciate that it's now more tactical and operational in terms of the work that you're actually going to do. But having these meetings and kind of forecasting what comes next, I think will be helpful for the public to understand because the 24-month roadmap now looks very different. So we needed to understand why.
James, did you have anything to add to that? James and I were splitting this up, and I probably just took his talking point.
I'm James Suckins, the CalHERS Project Director, and I think Director Belay answered my entire question before.
It got good to him. But before we move on to you, James, I would also hope that as you are having the meetings with advocates, that you would also share with the legislature so we have a sense of what the priorities are.
Yes, ma'am.
In this new world of 24-month roadmap that looks different.
Again, for 2016, very tactical. This is what we're doing. These are commitments. Into 2017, it's what are the initiatives? What do we have to look at? How do we scope these items to make sure that we know what it's going to take to be able to do that, to manage scope, schedule, budget, and then see where they slot with emerging priorities.
I completely get it. I'm just asking that you share it with the Budget Committee also, because that's a part of our responsibility also as we prepare for Budget 17 as well.
Yes, ma'am.
Thank you.
And James, talk about IV&V.
Okay, so the IV&V, there was a question about the contract ending.
4 and 5. You all know you laugh when I said 4 and 5 versus IV&V. You should have corrected me. IV and V. All right, I got it.
So IV&V, the contract that we have on the project ended. It expired in January 2015. And we had it on the project, and the project actually went live and was for practical purposes, the initial implementation was done in 2014. So typically what we do is we have IV&V on the project through initial implementation. So it actually stayed a year past that. But because we have functionality, we still have a lot of functionality that's planned for, and we talked about the roadmap, that's planned for 2016, 2017, and probably beyond. We do have a contract. We have QA on the project right now, and there's some questions about what did QA do versus what IV&V did, and we sort of explain those things. And QA really gives me a little bit more of an opportunity to direct the resources to where I think they should be. But
and QA is internal.
Yes, it is internal. That's true. But from my perspective as a project director, I have oversight from the sponsors, from both DHCS and Cover California. I have a Director Belay sitting next to me providing oversight. I have CWDA that's also on the ground that's providing oversight. So I have a lot of oversight on the project, quite frankly. But that being said, we do acknowledge that we should have IV&V on the project. And we did get some reports that asked about that. So we do have a contract to extend QA, and that QA contract does have an IV&V component. And to make it independent, the QA team will be reporting to me. IV&V team will be reporting to Director Belay.
I think the one thing that that James mentioned was it was timely as we did this. I mean, usually IV&V, independent validation and verification, is on a project through its implementation. It's went through the implementation, and we know that we have large releases and that we're doing those items, and we still have a lot of functionality that we're moving forward. But technically, we've moved into maintenance and operations, or development and operations mode. The quality assurance unit that the sponsors OSI put together, which is supplemented by private contractors, was really a timely item, so that it isn't only just identifying issues. It was a tool for James to be able to use as a strike force to be able to help shepherd in these things like a new governance process, to look at the process, to be able to put together some of these metrics and rigor that we've had. Now, since we have those things in place, we do believe that the independence, as well as the internal strike team, is important. So that's why, as we go and refresh that quality assurance contract, that we do have an independence to it, and we can have that IV&V reporting outside of the project, so we can have that going forward starting in July.
So as you see reference in the agenda, it was staff's assumption that you were not either going to continue the IV&V vendor contract, and we weren't clear about how the general function was going to be accomplished. So could you, now that we're clear, could you provide details to Budget Committee staff about that contract and what that all will look like?
Yes, ma'am.
Appreciate that.
And I think that addressed the questions on the.
I think it does as well. Any questions, Senator Monty?